What in the world is up, guys? Today I'm back with another video. As you can see from the title, we are going to be doing the second and final part of the two-part series regarding the different aspects that tie into the effects of lupus. Last week we did the suspected causes of lupus, and today, as I mentioned in my last video, we're going to be covering that second half. But next week I'm very excited because as of now I've been covering a lot of lupus specific topics in my channel, and so I think that not only will that benefit people in the lupus community, I'll also be talking about things that will most likely to some extent apply to everyone under that umbrella of autoimmunity. It's Autoimmune Disease Awareness Month, which to be honest I didn't even know until a couple of weeks ago, so stay tuned for that. But today we're going to be talking about specifically that criteria, that whole diagnosis process for the official lupus diagnosis. Let me tell you, it's not an easy process. A lot of people have complain about how complicated this process is, and there are a million reasons for this. People will go years and years without getting an official diagnosis from their physician. Reason being mainly because of the symptoms that we talked about in several other videos, how they can be linked to several other conditions. And so I did talk about that briefly in the signs and symptoms video, so you can go ahead and check out that video before continuing with this one. But if you really want to know what the general process leading up to the diagnosis, then stick around. One of the most problematic, controversial, complicated, however you want to look at it, aspects in the lupus community comes from the diagnosis process itself. So let me tell you, you don't know how many times I've seen online people complaining or just explaining how frustrating and complicated the process to their official diagnosis has been. And part of it is because lupus is a really good imitator of a different variety of conditions, and so that makes the whole diagnosis process a little bit confusing for some people. Not only that, but some people seem to believe that the criteria itself, the different points that you need to meet as a patient to be officially diagnosed with lupus, they believe that that in itself is complicated to say the least. And so let me just put it this way. So you could experience some of these symptoms that are listed in the American College of Rheumatology, the actual criteria for lupus that they have set up, and still not be necessarily a candidate for an official diagnosis. Or you can see it the other way and not have some of the symptoms that are listed on here and have your case misinterpreted, dismissed, or still be able to meet the criteria. So it is a little bit confusing. Generally, what your doctors will do, or multiple physicians, depending on who you're seeing, they're gonna look at two things. So they're gonna look at what they call a clinical presentation along with the actual lab results. So let's first talk about the clinical presentation. So that refers to the actual symptoms that your doctor is going to be able to physically see or feel in the person that they're examining. These are symptoms that are going to help build your case for the official diagnosis. And on that note, these are the symptoms. I'm going to put them up here. Most of your doctors will be looking to mark off at least a minimum of 4 symptoms listed on this criteria. Can range anywhere from the skin to your kidneys to your blood, anything like that. Like I mentioned, and as we have established, lupus can affect any different system in your body, any organ system, and so that explains why you'll have anywhere from a rash to mouth ulcers to cardiopulmonary involvement that has more to do with usually inflammation of the heart lining or that of the lungs. You also have things like kidney disorder, blood disorder, which usually is found in the form of anemia or any sort of damaged white blood, red blood, low platelet count / activity. And so those are just a few that are listed up here. You also have photosensitivity, which is a strong reaction to sunlight that causes those other rashes that are listed up here, and so on and so forth. So the last two that are mentioned up here are actually immunological disorder and anti-nuclear antibodies. And so I'll kind of touch on the positive ANA blood tests that most people with lupus become familiar with. So the last two are kind of, they go hand in hand and are probably the ones that most people with lupus have issues with in terms of getting a diagnosis. As you can see, not all of the ones that are mentioned in the last symptom video that I did are found in this criteria. They're considered more of your general minor, complementary symptoms that people with lupus will experience, fatigue and so on and so forth. But of course, they are more general. Anyone with any type of condition can experience extreme fatigue and things like that. So they're not necessarily part of the criteria. But keep it in mind that these also help to build your case and reinforce these other points that are mentioned that are considered part of this criteria. Sometimes these criteria are actually clearly visible if you simply look at the patient, do a regular physical exam. It can be really clear, like for example, if the patient is exhibiting some sort of, your typical lupus malar butterfly rash, or even like an ulcer or some sort of kidney disease through the presentation of body swelling or something like that. I'm sure right away you could tell there was something wrong with me when I went back to the doctor for the first time after missing a year. When I went back for my annual checkup, there was some weird stuff happening. Even the days or the weeks prior to that checkup, I had started to gain an unexpected amount of weight, and so that was around the beginning of the year. So I started doing all your New Year's resolutions. I'm gonna start working out, I'm gonna start eating healthy and all this stuff, and I was kind of on top of that for a while. So when I started gaining weight, I thought it was just because I wasn't like exercising enough, or maybe I wasn't eating properly or something. It was just kind of weird that I was unexpectedly gaining weight. My body hadn't started swelling up or anything yet, but when I went back to the doctor for the first time, I had really high blood pressure, and I also had a fainting episode actually at the doctor. And within that same week or two of going to the doctors, I was completely bloated, I was swollen everywhere. And so that day that I went to the doctor, they weren't able to draw blood on me, so I didn't have any sort of lab results to kind of suspect anything. I had just recently started going to that new doctor, I think, so I had gone 1 year, and then following that year was the year that I didn't go at all, and then I went back again. So I still didn't even really have some sort of they didn't have any real history of my past lab records or anything like that. But even then, I don't think that anyone else, any other doctor that I went to, had any sort of lab results to suspect anything of me. All they really got to see was just some weird fainting episodes, high blood pressure. That was kind of weird too. It should have been a red flag from there, but since they weren't able to do any true blood work or anything like that, then they kind of just left it like that. And I know most people will want to kind of focus on the lab results to kind of build their case, but I think carefully back to the clinical presentation and comparing it to the previous doctor visits, I think that really also helps. Ultimately, we are the ones that know our bodies the best, and if we feel that there's something wrong with us, we need to be the best advocates for ourselves, regardless of what the labs might say. I left the clinic that day not having any sort of lab results. I didn't even receive a call back from the doctors to get an immediate follow-up or check-up on for the blood work or anything like that. They just kind of expected me to, I don't know if they just kind of told me okay, we'll see you back in 365 days, whenever my next annual appointment was. So I would have had to either wait a year, or they told me just get it done whenever you can or something. I honestly don't remember, but there was basically no rush to have those labs done. So I had to be the one to personally take serious the physical symptoms that I was feeling. so that I could have them further examined. I'm not saying necessarily you have to trust everything that you Google about the slightest weight gain or a rash, because a lot of times even those tend to get misinterpreted when we're talking about lupus. But we do have all the right to inquire or suspect, if we want to, about any sort of unusual patterns that we're feeling in our health. So I know a lot of the times the doctors will kind of hesitate to do certain labs without a clinical presentation first, and sometimes that's for the best. If anything, I think that most of the time the labs are or can be secondary to the clinical presentation, because otherwise doctors, at least, they won't see a need or reason for them to go out and do, or prescribe for a lab to be done, or it might even be just harder for them to hone into what specific labs need to be done if there's no clinical presentation there. So yes, I do think that sometimes these symptoms actually set the precedence for the labs to be done, and therefore really, really important. But other times they are what kind of save us from having a lab misinterpreted. So the main reason why I wanted to bring this up is because of the whole controversy with the positive ANA test. Most people who believe that they have lupus will put their hopes in a positive ANA test. That's the anti-nuclear antibody test that they do with blood. But what this test does is that it looks for those antibody proteins that usually fight off those foreign substances in your body, in your own blood. Sometimes the doctors will use this test as a indicator for autoimmunity, but like I said, it could also be not necessarily a false positive, but can be misinterpreted or dismissed even if it is positive. It might be someone who's coming off of a viral infection or something of that sort. It might be someone that comes back positive and you might actually be autoimmune or have some sort of infection or condition like that, and you're just not experiencing the symptoms yet. You might just be either in the beginning of a flare-up or something like that, where you're not necessarily I guess aware of your symptoms. You're not necessarily feeling any sort of really bad or what's the word, I guess serious symptom, and they might just go ahead and dismiss your case, and then maybe a week later, after you come back with a positive and dismissed ANA, then all of a sudden you're feeling all these other serious symptoms. That's kind of what happened to me, and not necessarily in terms of testing the positive ANA and having it dismissed, but I did start feeling that day that there was something wrong with me, but because there was no lab work done, and also they just kind of had to go off of the clinical presentation, they kind of had to dismiss it there because there was not any other sort of serious clinical presentation at that moment. About a week later, within the 2 weeks after that appointment, was when I started getting serious swelling in my body. I started having joint pain, extreme fatigue, kidney disorder, and that's ultimately all those different combinations of the lab with those symptoms. Those are the things that will really help build your case and will help set a strong foundation for further investigation. I kind of just wanted to go back and focus on being your own advocate. I found a really interesting statistic that says 52% of patients minimize their symptoms, and 72% of physicians claim to be unaware that the patients are doing this, or not reporting certain symptoms. That kind of reminded me of a video that I had watched a while back. I don't know if you guys are familiar with the YouTube channel Jubilee. They usually do like discussions on like different topics and like political controversies or whatever, and so I saw this one that was on anti versus pro vaccine. I mean, the whole vaccine issue is something complicated in itself. What really stuck out to me was the overwhelming, I guess, agreement between these two very different parties. Everyone in the panel basically agreed that there is this strong existence of mistrust and lack of communication between patients and physicians. And so there was even some doctors there were some patients and parents, really just put things in perspective. A lot of people now have different opinions as to why this is a reality, but the reality is that a relationship between doctors and patients is not perfect. And so seeing these statistics really do show how much of an effect that has on our health. And so if we aren't communicating the way that we should be communicating to the best of our abilities, you know, how can we truly know that nothing else can be done for us? When I saw this, it really did take me back, because I'm the type of person that I like to avoid negativity, you know, showing hopelessness or weakness. I don't like to give in to, you know, the numbers or anything like that, because you know, at the beginning of my diagnosis, even now sometimes I have a tendency to kind of keep things to myself, just to not be, I guess, like some sort of Debbie Downer, like just so people don't have to see me in, you know, this type of way that, you know, like, oh, she's always complaining or in a weird mood. You know, I don't like to draw so much attention to myself, especially if it's just gonna change the mood. You know, even when I would see doctors, I'd just be like, yeah, like I feel better now. But on the inside, I was still low-key feeling the same way. And no, that's 100% my fault. And, you know, no matter how your doctor might communicate towards you, we still have as much of a responsibility. We still have as much, I guess, of a job to be 100% honest with them as they do to be open and to be reassuring with us. So with that being said, I will say, so reassurance is not necessarily the same thing as acceptance. I was a little bit skeptical about sharing this experience with you guys, but I do want to keep everything, like I said, as authentic and real as possible. So I would say around 2 months into treatment, I started having really weird, like the weirdest symptoms of my life. Like I was on a really high dose of like 20 different pills. That's when I was kind of beginning to feel like those hand tremors, those hallucinations, insomnia, everything. And meanwhile, I was also feeling this like really weird symptom of like something like leaking through my head. Best way I can put it. It felt like a line, like just picture like a line going, like cutting across like your forehead, and like something leaking out of your brain or something. Like that's the best way that I can describe it. I know it sounds really weird and crazy, but to this day, I don't really remember what exactly the doctor said to me about like the scientific explanation behind that, but I'm just glad that it went away, you know. But when I tell you that I was fed up with that symptom, I was fed up. I've never really been impatient with that many things. Never, like in the treatment process, really did I complain or anything, from what I know. But that symptom was something else. So when I went to the hospital, to the ER, I told them what was going on. So they had me admitted. You know, I had already been to the ER for a couple of times before that. But this time it was just weird, because they put me in a room with, it was just like a completely different room. Like, you know, your typical ER room is gonna have at least some sort of equipment, like your heart monitor, or like somewhere to put like the IV or some sort of thing to be transfused into you or whatever. But this room had basically nothing, and it had like, you know, your regular like bed stuff, but it wasn't like your typical ER room with like the equipment and all. Mind you, I was like high-key drugs, so no one really went over like the side effects with me, from what I know. So to me, everything that I was feeling was as real and true as I felt it. And plus, almost no one in the ER, from what I know, is really an expert on lupus. So they sent me instead to a psychiatrist, and that to me felt like a slap in the face, because all these different weird type of questions that they were asking me. At that point, I just felt like my head was going to explode or something. I just wanted to have an MRI done with. And just mind you, like even though no one really went over with me like the different side effects and things like that, to some extent I always had this feeling that, okay, maybe it's not real what I'm feeling, maybe it's just I guess the drugs or whatever, maybe it's the side effects of the drugs, maybe it's just a hallucination or something. And so I always try to keep it as positive as possible. I try to give myself some hope that like that isn't necessarily either real or something that I'm gonna have forever. But you know, it's still, even though you have those suspicions, you're still always bothered by it the more that you feel it. That was, you know, at a point where it was like basically 24/7. So I just wanted to have that MRI done. I just wanted to have my brain scan just to make sure that it wasn't actually something there. Instead of that, you know, long story short, they sent me a psychiatrist. And so that psychiatrist, after questioning me, was just kind of looking at me like, honestly, I don't know what the heck to do with you. So eventually they did the MRI and they didn't find anything. It was just like an overall weird experience, to be honest. They made me seem like I was crazy, and that just kind of put a little bit of fear in me to be as open with the physicians about my symptoms, especially that symptoms. I never really brought it up again until I went back to my kidney doctor, and he brought it up when, honestly, like, I had really bad memory at that time, so I don't even remember ever bringing it up to him. But that was kind of when he explained a little bit about why I was feeling that symptom. He never really made me feel like I was crazy or anything like that, whether it actually was something coming out of my brain or just some sort of sensation that I was feeling. He was always very reassuring about it, and without actually agreeing with me. It was quite a difference in those two experiences. So once again, friends, if you're trying to be a nurse or a doctor, just know patients really do want to be open with you as much as possible, but we just need to be reassured that we're in a space that we're okay to just open up, to feel comfortable about talking about anything with you. But anyways, that's just something else that I kind of wanted to talk about. So back to the diagnosis process. Like I said, you will usually have to meet at least 4 of the 11 criteria points and have them not only met, but you also have to have them complemented by lab results. What exactly are these tests? So depending on the symptoms that you're experiencing, they'll kind of test for different things. I already talked about the positive ANA blood test, but they'll also look at other blood tests, including those that detect the antiphospholipid antibodies for blood abnormalities, you know, like the blood count, lupus anticoagulate, anti-double-stranded DNA, which doctors, they'll usually use that to kind of monitor the activity of the lupus in your body. Another thing that they do, like if you have some sort of blood or kidney abnormality, they'll go ahead and they'll also order a biopsy, which are they're not fun to say the least. Oh, and lastly, also mention like x-rays and imaging tests like your MRIs, CAT scans, EKGs, urinalysis. They'll do ESRs, which also test for inflammation rates, and so those are all different types of things that they can also do to kind of test for official diagnosis. So generally these are the tests that they'll do, but obviously as they investigate more and more into your case, they might reorder some of the tests or go ahead and order other types of like procedures to be done. Of course, they run into something like anemia or something like that, or an iron deficiency, they might go ahead and start you on some sort of treatment to manage the symptoms that you're currently facing. So they might put you on some sort of blood or iron transfusion. In my case, what happened was they had seen from the get-go the condition of my kidneys. Obviously they were failing, so they scheduled me right away for paracentesis because I was accumulating so much water and fluid in my body, like I literally looked pregnant. They had to go ahead and schedule that paracentesis to extract fluid from my body. So they'll kind of just stick a needle in whatever area that's swollen, and they'll kind of just use that to extract the fluid. If you guys want me to talk more about the first hospital visit that I had, I can definitely do that for you guys in another video if you guys would like. As you can see, there are a lot of different tests and information to regurgitate, but it really does help to know what these different tests and procedures are, because that kind of just eases the whole process in knowing why they're sticking like a million needles in you, or you know, needing to scan or cut something. So yeah, so that's the end of the video. I hope you guys enjoyed it, and stay tuned for next week's video. I'm going to be talking about how I personally manage and deal with my chronic illness on a daily basis, and that will be in remembrance and in regards to the celebration that we're doing this month for Autoimmune Disease Awareness Month. So stay tuned for that. See you guys in my next video, and yeah.